I'm making this video, and this is an extremely important video on cancer and weight loss. And this is a big thing that you'll see, and I use TikTok a lot. I'll go through TikTok. I've seen tons and tons of videos in the last month or so of people that are posting family members or loved ones that died, and it's terrible. And every single picture before they died, they've wasted away to nothing. Then they show the pictures of when these people are fine. They look great, they look healthy, and in fact, what's even crazier is that most of the pictures seem like they're people between the ages of 35 and maybe 60. I'm just throwing that out as a random. There's a lot of them that I've seen. So anyway, I know a number of people that have battled it. I've battled cancer myself, and in the back of my mind, I'm thinking to myself, does losing all this weight make you more susceptible to actually dying from cancer? And I don't know what made me think of it, but I looked it up, and it's actually true. And so this is a great video. This is an alarm that should be going out to everybody. I'm going to read you some things here that I've looked up, and you can come up with your own conclusion, but I would tell you this is extremely important, and this is something that I think every single person should focus on. Even if you don't have cancer, exercise and working out is good for the immune system. So here you go. Short answer, yes, significant unintentional weight loss during cancer treatment can weaken the body and immune system, and that can negatively affect outcomes if it isn't addressed. But weight loss itself does not cause cancer to spread. No, but it weakens the immune system. That's what can cause problems. What's actually happening in the body? Cancer plus treatment can cause cancer cachexia. This is not just normal weight loss, but it's loss of muscle, not just fat, driven by inflammation, tumor metabolism, chemo effects, appetite loss, nausea, taste changes. Muscle loss happens even if calories seem adequate. This is important now. This condition is very serious and affects up to 50 to 80% of advanced cancer patients. Now, maybe more doctors are starting to talk about this, but prior, most of them didn't. And they put people on chemo and they don't tell them anything. If you're gonna get on chemo, first thing you should be doing is probably going to the gym and making sure you're working out and eating, finding a way to maintain calories and maintain weight instead of just losing 50 to 100 pounds and wasting away and your body sucks into nothing but bones and there's no muscles left. That's terrible. Here's the next important thing, how weight loss does increase risk. Immune suppression. Loss of muscle equals loss of amino acid reserves. That's extremely important. Immune cells need protein to function. Reduced T cell and NK cell activity. Increased infections. Reduced tolerance to treatment. More chemo side effects. Higher chance of dose reductions or stopping treatment. Slower recovery between cycles. How important is it to work out, to eat right, to take care of yourself? Listen to what I just said here. It's beyond important. If you want to live going through this battle, you better figure it out. I believe weight training is something that every single person should do their entire life, especially as you get older, and especially if you're going through cancer and taking chemotherapy or any of these other cancer treatments they want to give you. And a lot of people get sick and they think, well, I can't work out, I can't do this, I can't eat, and then they waste away, and then their body's more susceptible to checking out. It's terrible. Here's another one. Why doctors take weight loss seriously? In oncology, unintentional weight loss, 5 to 10% is a red flag. It's linked to worse outcomes, poorer quality of life, less effective therapy. This is why nutrition is now considered a core cancer treatment, not supportive care. Got that? A core cancer treatment is weight protection. You want to maintain muscle mass and weight. Can this be prevented or reversed? Sometimes yes, sometimes partially, depending on the cancer and the stage. Helpful interventions include high protein nutrition, often liquid or medical grade, resistance or light training in the gym. Even if it's bed-based, you can still do something. But if you have the ability, I say go to the gym. And I'm not talking about heavy, hurting muscles and tearing ligaments and any of that stuff. I'm talking about blood flow to all your muscles. Even if it's a light, full body workout every day, there's something that you need to do to maintain your muscle and try to maintain your body weight. Resistance or light strength training, anti-inflammatory nutrition, appetite stimulants, treating nausea, mouth sores, gut issues aggressively. So important clarification, cancer does not kill people simply because they lose weight, but severe weight and muscle loss weakens the immune system. limits treatment options, increases complications, and raises mortality risk. That's very, very important. Very important. Now, so I looked up even more stuff here. So, does exercise and weight training during chemo treatments help battle cancer better? And the answer, yes. When done safely and appropriately, exercise, including weight strength training during chemotherapy, has been shown to help patients tolerate treatment better and is associated with improved outcomes. This is no longer controversial in oncology. I'll be very clear about what it helps, what it doesn't, and how it should be done. So, what exercise during chemo does help with: preserves muscle and immune function. Got that? It preserves immune function, which is what you need to beat anything. Muscle is a metabolic and immune organ. Strength training slows or prevents muscle wasting. Better preservation of T-cell function, natural killer cell activity, lower inflammation markers. Patients who maintain muscle mass generally tolerate chemo better. They should mandate that anybody that's going to take chemo should be lined up for working out and exercise and making sure that you can find a way to maintain your weight or maybe even put on a little weight. Improves ability to stay on treatment. Studies consistently show fewer dose reductions, less treatment interruption, faster recovery between cycles. This matters because completing planned chemo improves survival odds. Reduces fatigue. That's a big one. Inflammation, muscle loss, mitochondrial dysfunction, light to moderate exercise. Improves mental resilience, lower depression and anxiety, improves sleep, greater sense control. Does exercise make cancer spread? No. There is no evidence that exercise causes cancer spread. In fact, regular physical activity is associated with lower recurrence rates in several cancers: breast, colon, and prostate. Exercise improves tumor oxygenation, which can make chemo and radiation more effective. So there's a lot there. I can make a super long video, and this is probably longer than most people want to watch. But what I want to tell you is, if anybody you know or anybody that's listening to this is going through cancer, the biggest thing you need to do is figure out what you can do for exercise and weight training and building muscle. Just going out for a walk isn't enough. You got to build your muscle. You got to pump your muscles with weights that can pump the muscles with blood. And you got to figure out what you can do for food. Because a lot of people think, well, I got to go on long fasts. Yes, I believe in fasts, maybe a day or two here and there. But you have to figure out a way to maintain your diet and maybe even more so that you can keep your body weight or even put on a little weight if you need to. Now, it depends on the person. If you're vastly overweight, then yes, you can lose some weight. I'm not trying to say that you can't, but weight is very, very important. So anyway, please share the video and do all the research. I'll try to cover more of this in the future.